that's a completely different topic that I am touching in another presentation. So, I mean, what we have been doing, first of all, was to try to compare the outcome of those patients that have been treated with CAR T-cell for relapsed refractory diffuse large B-cell lymphoma. This is the disease that it's basically being touched upon in this presentation. So we are comparing the outcome of patients being treated outside prospective clinical trials with the outcome of patients that were initially treated in the pivotal trials that at the end of the day gave the indication for CAR T in relapsed refractory diffuse large B-cell lymphoma. And what we saw from this, or what we have seen from these comparisons, are basically two issues. First of all, that the long-term outcome of patients being treated in real world, so real world data, are quite similar to the long-term outcome of patients that were included in the pivotal prospective clinical trial. And these data come basically from the real-world data that have been presented by the American centers. Unfortunately, the experience of Europe as a whole, or European countries in terms of CAR T, is not as big as the experience that they have in US. So basically now all this knowledge is coming basically from the US data provided by the centers. So that's one thing. And then the other thing which is important to take into consideration is that a significant proportion of patients that were treated with CAR T cells in our daily clinical practice had a significantly worse in principle prognosis, or a higher number of adverse prognostic factors than those patients that were included in prospective clinical trials, which this is one thing that might seem quite obvious, because usually patients included in prospective clinical trial represent a more highly selected population of patients. So that's important to know. And then of course what we are trying to do nowadays is to identify basically clinical characteristics of the patients and lab characteristics of the patient that could eventually identify patients that either are going to do worse after CAR T-cell therapy in terms of long-term outcomes, so patients that are alive and disease-free after the procedure, or that are going to tolerate less well the treatment, so basically are going to develop more side effects, or these side effects are going to be significantly more severe. And just to make the story short, there are some clinical data and lab data that are basically related to the amount of disease that the patient has on board at the time of being treated with CAR T cells, and the performance status of the patient at the time to be treated with this treatment, that negatively impact in both the long-term outcome of these patients and the toxicity that these patients are going to have after treatment. So patients with higher disease burden and with more deteriorate performance status at the time of being treated with CAR T are in principle those that are going to have more disease relapse after CAR T, so a worse long-term outcome, and they are going to experience more toxicity from the treatment.